If you're overweight or have a BMI above 26, you might wonder which birth control method is safest and most effective for you. The benefits of using birth control are clear, whatever weight you are. This video is a detailed breakdown looking at how and if being overweight affects your birth control. So it's slightly long due to some necessary explanations I need to make, but it would really be useful if you watch it through to the end. If you haven't got the time, you can skip to this timestamp to learn which methods are best for overweight women, and to this one to learn about safety implications. In this video, primarily, I will be referring to guidelines from the Faculty of Sexual and Reproductive Health in the United Kingdom. So, let's begin. You've probably heard that birth control methods do not always work the same way in all women, and that it is possible that your weight may affect the effectiveness of your birth control method. We begin with the IUD, the intrauterine device or coil, which has a typical failure rate of 0.2 per 100 woman years. This means that out of 10,000 women using this method, 20 will fall pregnant in the first 12 months. Since the contraceptive effect of the coil happens primarily within the womb, there is no reason to think that these IUDs will be less effective in overweight women compared to normal weight women. There are some accounts of inserting the coil being technically a bit more tricky in a lady who's overweight, and a concern that it may be pushed out or expelled out more easily than in normal weight women. Still, we need more studies that explore these issues reliably. And so, because it is highly effective across the entire BMI or weight spectrum, the coil is an excellent choice for an overweight or obese woman wishing to delay or prevent pregnancy. Next are the implant, another effective option with a typical failure rate of 0.05 per 100 woman years. In other words, out of 10,000 women using this method, 5 will fall pregnant within the first year. Implants contain the progesterone hormone in either of two forms, etonogestrel or levonorgestrel. According to our data for the etonogestrel implant, the hormone levels reduce slightly over time in overweight women compared to normal weight ladies. However, that decline does not go beyond a level that would prevent the suppression of ovulation. What does that mean? That means that while the hormone levels are a little bit lower in overweight girls, it is still effective for birth control. And currently, the Faculty of Sexual and Reproductive Health does not recommend changing the implant earlier than the recommended 3 years because a lady is overweight. For the levonorgestrel implant, studies show no difference, and it is thought that body weight does not reduce the effectiveness of this method for overweight ladies. The depot shot is another highly effective reversible contraception that lasts approximately 8 to 12 weeks depending on the brand you're using. It's available as an injection into the muscle or underneath the skin. Its typical failure rate is 6 per 100 women years, which means 600 out of 10,000 women will fall pregnant within the first 12 months of using this method. Studies suggest that being overweight does not reduce the effectiveness of the depot shot. While giving the depot shot to an overweight woman into the muscle, a longer needle might be necessary to advance beyond the fat underneath the skin. An alternative shot is the progesterone injection called norepinephrine that is given every 8 weeks. And a study showed no difference in the amount of the hormone in the blood when taken by both overweight and normal weight women. So now let's look at the combined methods of contraception. These methods have both the hormones estrogen and progesterone with a typical failure rate of 9 per 100 women years, meaning that 900 out of 10,000 women using this method will fall pregnant in the first 12 months. But let's look at the different options, specifically starting with the pill. Some studies found that overweight women with a BMI more than 25 were almost twice as likely to become pregnant while relying on the combined oral contraceptive, that's the pill, compared to their normal weight counterparts. Other studies found no difference. While the data appears to be conflicting, the conclusion seems to be that pregnancy rates among overweight women using the pill appear to be similar or just slightly higher compared to normal weight women. And next, let us look at the patch. The patch contains a similar combination of hormones as the combined pill. Compared with the pill, in normal weight women, the patch delivers a higher quantity of hormones into the blood than the pill. But this is reduced slightly in overweight women because of larger area and weight effects. A number of studies show increased pregnancy rates in women over the weight of 90 kilograms using the patch, which led the authors to conclude that women in this category might experience a higher risk of contraception failure when using the patch. Next is the ring. The contraceptive vaginal ring provides a weekly contraceptive method that goes into the vagina and is great for women who like a short-term birth control. Now, we only have a few studies comparing normal weight to overweight women on the ring. Still, the available studies suggest that there is little difference between the effectiveness in either groups of women. And now let's look at the mini pill, also known as the progesterone only pill. This method also has a typical failure rate of 9 per 100 women years, which means that 900 women out of 10,000 will fall pregnant within the first 12 months of using this method. And according to studies, the effectiveness of the mini pill is not affected by weight or BMI. Therefore, if you choose to have the mini pill, you don't need to take a double dose to achieve birth control. And let us look now at the emergency pill. We have the levonorgestrel morning after pill, which effectively reduces pregnancy risk if taken within 72 hours after unprotected sexual intercourse. Alternatively, we have the Ella pill, which is effective up to 5 days after unprotected intercourse. Both work by delayed ovulation, and if taken within 72 hours, the first prevents 50% of unplanned pregnancy, while the Ella prevents 66% of unplanned pregnancies within the first 72 hours. Weight does affect their effectiveness, and to a greater extent with the levonorgestrel than with Ella. Studies show that overweight ladies are 4 times more likely to fall pregnant after using the levonorgestrel pill. Pregnancy is twice as possible on the Ella morning after pill. Okay, so now we've looked at these 6 hormonal methods. Let's change tack a little bit and look at safety concerns for overweight ladies. First, there is always a possibility of unplanned pregnancy with any method of birth control. For some of these methods, overweight women may be at greater risk of unplanned pregnancy and its complications. However, hormonal contraception is safe for overweight women who don't have any pre-existing health conditions that could contraindicate the use of the birth control method. Our guidelines advise that there are no safety concerns with using any progesterone-only contraceptives in overweight women. And these include your mini pills, injectables, implants, and coil. Even the combined birth control methods are relatively safe if you are overweight. The biggest safety concern with using the combined birth control method when you are overweight is developing a blood clot within an artery or a vein. Now listen to these 2 statements. Overweight women are twice more likely than normal weight women to develop blood clots. Second, overweight women on combined birth control methods are more likely to develop blood clots than overweight women who are not on that form of birth control. And this refers to any combined method, the pill, the patch, or the ring. That said, let's back up a little and put this in context. The risk of developing a blood clot in a woman of childbearing age is relatively small. There is a much higher risk of developing a blood clot when pregnant or within the immediate postpartum period. So listen to this 3rd statement. An overweight woman on the combined method without any other medical condition is actually safer from blood clots than an overweight pregnant woman. Okay, so let's look at the best birth control methods if you're overweight. I think that if you're overweight and wondering which birth control method is safest and more effective for you, you shouldn't worry. The choice of method is very individual, and the presence of many options is actually a plus rather than making you feel uncertain or just unsure because there are so many to choose from. Concerning safety, as long as you have no other risk factors or underlying medical conditions, you can use any of these options. However, the progesterone-only methods should be at the top of your list for safety. Regarding effectiveness, you can also use any of these methods depending on your health background, preference, and what's available to you. Also, think about it when it comes to effectiveness. Using any of these methods is better than doing nothing to preventing an unplanned pregnancy. With that said, the research does indicate the patch to be less reliable among regular short-term options. So you should go for longer acting methods like the IUD or Coil, the implant, or the depot shot. If oral is your preferred method, you can use the combined or the mini pill or the vaginal ring. But keep in mind what we've said about the slightly less effective nature of the combined methods compared to those that contain progesterone only. If you do go with the patch, consider using a condom to provide you extra protection. So let's look at what is the most effective emergency birth control method if you're overweight. Suppose you're over 70 kilograms or have a BMI over 26. Then, according to the UK's leading authority on reproductive health, the Faculty of Sexual and Reproductive Health, the most effective method is the copper coil inserted within 5 days of having unprotected sex, if this is appropriate for you. If that option is not appropriate or is not acceptable, then the Ella single dose pill is an option that you can use again within 5 days of unprotected intercourse. Finally, the last option is the levonorgestrel morning after pill, such as post pill, Postinor, Levonel, Take Action Plan B, and so on. Commonly, it is thought that the standard dose of these pills is not effective in women over 70 kilograms or above a BMI of 26. And so the recommendation is to double the dose of the levonorgestrel pill if you're taking them and are overweight. But is this double dose guaranteed to work? Recent studies suggest even the double dose levonorgestrel may not be effective in overweight ladies, but we do still need some more work to confirm this. So if you are overweight and need to use the levonorgestrel pill, the double dose is safe and better than doing nothing. Thanks for listening. I hope this answers many questions about your weight and birth control safety or effectiveness. If you need further clarifications, please reach me via our email health information service. That's the link, and I will leave it in the description box for you as well. Please give this video a like and let me know what you think about it. That tells the YouTube algorithm that it's helpful, and so it shares it to many more people. And you can also share it with a friend. Help me share this knowledge so that other women can also make safe birth control choices. Check out these other titles in our birth control playlist, and I'll see you again soon.